We more often have open beds in our withdrawal management unit than we are full. And that has been consistently the case for over a year now, well over a year.
That was the chief medical officer at Fora Health, one of just 2 large-scale treatment and recovery centers in Portland. They routinely have empty detox beds, which seems crazy, right? I mean, I've done countless stories talking with people struggling with addiction on the streets. Well, doctors and nurses at Fora Health don't know why they're seeing fewer people seeking withdrawal management. But staff there tells me there needs to be more recovery housing, also known as sober living, places they can send people after they go through detox. Because what happens now is people are repeatedly getting discharged from detox to the streets, and the cycle of drug use often starts all over. So it seems obvious that more recovery housing is needed. However, and this is where the plot thickens, this morning, I heard from providers who work in recovery housing, and they tell me they have empty beds too, but for different reasons.
If you're coming into a house, I want to make people feel human.
For people like Troy McChesney.
Right now, though, with the funding shortage, I have 2 empty beds here.
An empty bed.
So up here we have another bonus room, and I have 3 empty beds up here.
Means one thing.
Well, it saddens me because my whole thing is I want to be able to help people.
He's got 6 empty beds in this Southeast Portland home.
Just sitting here vacant, waiting for people to come in.
Troy runs Premier Sober Living, which has 8 recovery homes like this one across the city. And it's not cheap.
It's somewhere around $750
per bed per month. Typically, Troy would rely on money called flex funds to cover that cost. That's money from coordinated care groups like Care Oregon, a nonprofit health insurance agency funded by public programs like Medicaid and Medicare. They tell us they've created a stricter application process for these flex funds in an effort to reduce waste and fraud.
And then I was able to utilize those funds so then they can stay in housing for a duration of 3 months, essentially as an operational cost to be able to help support them in this process.
Troy says since August of 2024, he has not been able to access that money.
All of these flex funds disappeared, and it was just overnight.
Meaning he now might have to close some of his recovery homes.
I think that there's a lot of people that are going to suffer from that. I mean, I was looking at potentially putting about 100 people into homelessness.
And that, he says, has been the case for some.
Yeah, there's people that I've had to say, hey, I can't carry you anymore. These funds didn't come in. You have to go back to the streets. They return to use, they return back to detox centers and repeat the cycle.
That almost happened to Anthony Cook.
I'm here for a week and they tell me your funding didn't go through, so we need you to pay $750 to stay here in the program. Luckily I was able to come up with the money. It's due again today, so I'm going to be trying to come up with another $750 so I can stay because the program's amazing.
What happens if you can't find the $750?
They'd kick me out. They'd give me a 24-hour notice. So.
What do you think about that?
I think it could put me in a bad situation, on the streets again in Portland. My trap house is only a couple blocks from here, so.
It's devastating that just because people don't have $700 to move in, that they're turned away.
At West Coast Sober Housing, Solara Salazar tells us that happens every single day.
20 to 30 people per day we turn away.
All due to a lack of funding.
So we have 73 beds total right now, and we have 30 open beds that we could serve people today if there was housing funding.
Prior to losing the Care Oregon Flex funding, she housed people under the impression it would be reimbursed.
I think when all was said and done, we were left $34,000 in the hole and never saw a dime from any of the applications.
And getting that money back has been no easy feat.
I think here I have almost 30 different reasons given for denials.
I know 30 different sober living organizations that lost money due to the change in the flex funds.
We really just want a clear answer. Should we keep trying to access HSRN funds for recovery housing, or do we need to look at alternative funding sources or shutting down housing? So the word is out there. People on the streets know that they can't get housing after detox. So in their mind, why even bother?
Care Oregon declined our request to go on camera today, but they did send us a statement. It says, because sober housing is not a covered Medicaid benefit, but a need for some of our members, Care Oregon pays for these services through an innovative program called Health-Related Services Flex Funds. Care Oregon continues to pay for sober housing services when these services meet our communicated criteria and with the required documentation. They went on, saying, due to concerns about fraud, waste, and abuse in this space, Care Oregon has made adjustments to our HRSF process in an effort to keep these services available while being good stewards of taxpayer dollars. So the money is there, it's just harder for providers to access with more hoops for them to jump through. As you heard from that one provider earlier, she says she's received dozens of different denial requests for the funding from Care Oregon. I mean, she's documented them right here on this paper. And as she said, she just wants a clear answer. Okay, so now it is your turn to weigh in. Let us know what you think about this saga of empty detox and recovery housing beds. Email us, thestory@kgw.com, or call and leave a voicemail, 503-226-5090.